is called to order at 7:03. We do a roll call.
We sure can. All right, Strassman.
Here.
Hilla.
Present.
Roberts. Cronin.
Present.
Johnson.
Here.
Miller. Lonsdorf.
Present.
Schnapp.
Here.
Lugenbull. Here. Chief Anderson.
I'm here.
And Deputy Chief Dastelek. Okay.
Okay, thank you. We have a quorum. Was there any public comments?
I did not receive any.
Then let's
Nope.
move on to the presentation by Anthony Dare
Yep.
on his
So-
EMS research.
Yeah, so he's dialed in here. I'll let you introduce himself. We've connected a couple of times over the last few months. I think you've all gotten some emails from him. So I thought it would be a good idea to come and have him introduce himself and kind of tell you what he's got some ideas of some projects he'd like to work on. So Anthony, I'll let you take it away. Once you take it off mute, I'll let you take it away.
Sorry. Hi, everyone. My name is Anthony Dare. Just a little bit of background about me. I'm a resident of Fitchburg, Wisconsin. After Thanksgiving, I will also be a member of the EMS team for Wisconsin Department of Health Services. I will be a project assistant, so I'm very excited to start working on that aspect. I'm here to kind of just present a couple of research projects that I'm kind of undertaking with the supervision of Chief Anderson. So without further ado, I'm going to present a presentation relating to them. Patrick, am I able to share my screen if that is okay with you guys? Okay, awesome. Share. Sorry. Okay. Show. All right, awesome. Can you guys see it okay? Awesome. Sounds good.
Yeah.
And sorry if my my image is kind of fuzzy. My computer is not the best in terms of quality, so please forgive me on that. So as I stated before, name is Anthony. I'm doing a couple of research projects relating to EMS services and particularly Fitch-Rona EMS services that'll kind of more side research projects to kind of have like a better understanding about obviously EMS and Fitch-Rona EMS in general. So the intro, I'm conducting 4 kind of separate research projects relating to EMS services and we'll obviously present these to the Fitch-Rona EMS Commission. And so because I'm doing these projects for the EMS Commission, I will always love input or contact or any kind of input from the Commission about these projects relating to it. So why am I doing these projects? So the reason why I kind of wanted to do these projects was to, one, get more involved in my kind of Fitchburg community. I love local politics. I love getting involved and learning more things about my community. And then obviously the second reason I kind of wanted to do these kind of side research projects is to learn more about Wisconsin's EMS system and how it affects municipalities like ours. So the next couple slides, I'm going to talk about kind of the bare bone structure, or not structure, kind of surface of these projects. These are all very kind of in the works at the moment. But as I continue to do more research, they will have kind of more meat, more presentation, and more of a kind of driven thesis behind them. So the first one that I am going to be undertaking, and probably the most important one, especially since it's due to the town of Madison annexation, is related to service increases relating to Medicaid and non-insurance. So there are definitely different theories about different insurances, depending if they're Medicaid, Medicare, or non-insurance coverage populations, kind of determine, or there are theories that certain insurances are prone to use more emergency medical services rather than other insurances. For example, scholars throughout the years have always said that Medicaid of all kind of insurances is the one where EMS, Medicaid just uses EMS often. Whereas people who are on private insurance probably don't use EMS services that often. So I will be here to kind of discuss and study these theories about insurance and kind of EMS services. And then obviously talk a little bit about how that relates to the town of Madison. As you know, the hot gossip in Fitchburg is that we are obviously annexing the town of Madison. And with the annexation, we bring in a new kind of population of different demographics. Many of the people who are in the town of Madison, there are higher rates of uninsurance and there are higher rates of Medicaid usage in the town of Madison. So kind of studying those aspects to this project are really important. The kind of second project that I have thought about undertaking is the one about body cams. So across kind of the EMS landscape, there's been talk about how EMS services are using body cams, certain EMSs, not all, for kind of either a couple of reasons. One is because body cams give us more photographic information and documentation. And then another reason why people use body cams is solely because of EMS accountability. And obviously the kind of political movements right now are kind of raising the usage of body cams solely because of police accountability and other things like that. But then there's also issues, there's kind of a backfiring issue of how body cams can possibly violate HIPAA violations and privacy for patients. So this project would be used to kind of study the kind of two sides of that argument. The third project that I'm thinking about undertaking is relating to a comparative study on EMS systems between Illinois and Wisconsin. So obviously, Illinois and Wisconsin are neighbor states, but they have so much similarities and so many differences. We deal with people from Illinois all the time. We deal with Illinois government all the time, especially since Madison is very close to the border. And so kind of learning how both of these states kind of run EMS would be very beneficial. Obviously, I would read and analyze state statutes between both states, learn a little bit about each of the states' licensure, their ambulance standards, and then set up the state, county, and municipal EMS systems. And then the fourth little project is maybe more kind of just like a current events one relating to kind of what legislation is being brought up relating to EMS from the 2021-2022 section of the legislature, talk about the proposals and where these kind of bills are sitting. And so, yeah. So I guess I'm gonna exit out of here. Sharing. Do you guys have any questions at all or comments or concerns?
I just have one question. My name is Sue. I represent the town of Verona.
Mm-hmm.
Knowing that the police use these body cams, is there anything you can glean from them on what you're doing for this work so you're not recreating the work?
So that's a really good question. So the body cam situation from what I have learned so far between EMS and the police situation are kind of two different situations. Obviously, it all has to do with the kind of work both of the organizations do. Police is very much more regulatory, security, kind of looking over other people Whereas EMS is more on the relationship side of patients and trying to get specific care to other people. And the reason why that's such a worry for having body cams for EMS patients is because whenever a patient enters into an ambulance, they have the right to have as much privacy that is garnered for patients. And, if they're having a camera kind of hovering over them, when they're, trying to get care, that kind of violates many privacy issues. And there are many kind of laws, regulations kind of being replaced by this, but it's still very kind of new. It's very, very new compared to kind of the body cams for policing.
Andrew, I have a comment if I could.
Yeah.
Yeah, I applaud you for doing this research. I think if you stay on the call, you'll find that when we start talking about our budget coming up and our raising prices, one of the big considerations is new population coming into the Fitch-Rona EMS coverage and what effect that's going to have on our budget. And is the question of should we raise prices to individuals or should we have the municipalities pay more money, knowing that a lot of the individuals maybe can't pay the money. Mm-hmm. And so I hope one of the things you'll be studying is the effect on our budget and our income of the population changes we're about to have. So,
yeah, thank you so much.
Yeah. How do we get a hold of you if I would want to talk to you further? Do you have an email or something that you'd share? Or?
Yeah, I could write that in the chat, and I could also give, I'll just type in my email.
Yeah, if you chat it, that'd be great. Thanks.
Yeah, of course. And and please give me as much input or research material or kind of questions as much as possible, and I'll see what I can do to answer them.
And I can share Anthony's information with everyone tomorrow as well after the meeting. I think one of the questions or concerns that came up with one of the projects here is, the time commitment or there's zero cost to Fitch-Rona. So there's no budget dollars for us. It's really, I think predominantly the few conversations I've had with Anthony is really it's using us as a sounding board for a lot of the information as well. If there's additional questions that I can provide that information to. As David had just mentioned, I think some of that very first question he had about the town of Madison and kind of utilization of Medicare and medical assistance. So probably delving into a lot of Fitch-Rona's numbers for that. We'll absolutely make sure we have the right confidentiality contracts in place before we can get HIPAA compliant, obviously. But short of that, I think truly the only cost is going to be to Fitch-Rona is a time cost. Between myself and Jeff, or if any of our medics want to get involved in pulling that data. I know we have a couple of data gurus out there, but truly that's going to be the only commitment from Fitch-Rona or the cost is that time commitment to get him some of the information he needs for us and then wrap that back around to present to you.
For sure. And and I'm all about not spending as much money, so.
Does anybody else have any other questions? But I just wanted to make sure that he got out here and talked to you all because he was doing some polling, kind of some opinion polling of some of our staff and city councils, and with our shared district here, some of that ventures into some uncomfortable areas at times. So I want to make sure we were very upfront with everybody about kind of what he was trying to do.
Yeah, and thank you guys so much.
Thank you.
Yep, thank you.
Of course.
Taking the time to present. Appreciate it.
Thank you, Terry.
If there's no more questions, we'll move on to the next agenda item. That's a review and approval of the September 16th meeting notes. Any corrections? If not, support a motion to approve.
I'll make a motion to approve.
A second?
Second.
All in favor, signify by saying aye.
Aye.
Any opposed? Hearing none, the minutes as submitted for September 16th are approved. We'll move on to the Chief's report. Patrick?
So that got emailed out to you. I've got it shared up in the screen there. I'd like to think that things have leveled out a little bit. So we've only got about a 29% increase from last month.
Oh, wow.
Right, versus what we've been seeing. It's calmed down a little bit more over the last couple of weeks again, but it's just kind of the nature of what we've been doing. So we're still sitting at about a 20% increase for the year. Again, just some weird numbers. Pulling out the Align Energy Center numbers in there, we did do some COVID clinics. I'm trying to think what that special event was that we supported in September, but we've been out there. So I still pull those out there because those really will not contribute. I mean, in the big picture of things, they're pretty minute impact, but to truly look at real numbers out there, I do pull those out of there. Otherwise, the numbers here look pretty much like they have before. We're shooting for, we're going to be right on target for 4,100 calls, but I was really anticipating 37. So that number just continues to go up. The breakdown of the municipalities a little bit more in Fitchburg than we've seen in the past, but otherwise those are equally spaced out there. It'll be curious to see, and I can point this out as we continue to progress down the road. So Mount Horeb has actually started to do some flexible paramedic staffing. One of the regulations or rules, administrative rules for the state of Wisconsin, allows new services to, as they're becoming paramedic services, to staff at a paramedic level when they have those medics, and then to go back down to a lower level when they don't. So Mount Horeb is actually venturing down that pathway. As we see that, we're probably going to see a decrease in numbers of calls out to Mount Horeb as they have the staffing. They won't be needing to be calling for intercepts anymore. So we'll keep an eye on that over the coming years. Our times are where they normally should be, again, right up around 11 to 12 calls per day. We just finished our consortium training this month, was the happy topic of SIDS with Dr. Kim from UW Hospital. Back right in it again with our COVID clinics. I don't remember if I shared, or I think that maybe has come up since our meeting last month. We're back out at the Align Energy Center as of, we are just starting our second week out there. So public health is back out vaccinating. They're predominantly trying to vaccinate. Their focus is that pediatric population with the new approval for the 5 years and up. But they are doing all boosters and initial vaccinations as well. So we're out there Tuesday through Saturday with our crews. The numbers you see up there are pretty par for what we've been seeing with the days of the week. As usual, our falls and sick person numbers just continue to flop back and forth. 'Tis the season for more traffic accidents. Station number 2 continues to be the most. Reminder, as you're seeing our aging report here, we had those last 2 weeks of September where we had the ransomware issue with our billing company. So last month you saw some weird numbers with aging. So this month you're going to see a weird number with aging. Right? So last month we had the 2 weeks where they couldn't bill anything or receive anything. That rolled over into this month. That's why you see such that large number that's sitting there in the 30 to 60 days out, because it's just catching up with the billing cycles. But where you see that total dollar line item, that $760,000 that is still out there in billing, we're just now starting to see the kind of the income from all these, that huge one volume that we've been experiencing. We're going to start to see that in billing wise. As far as cash on hand, nothing surprising or out of the normal there. Assigned balances, those are it. We haven't spent any of our FAT money. I'll have to add it in there with our Epic money that we did get in there for our ventilators and our Lucas device. I know I've shared that. What we put in for our Epic fund this year was two more ventilators and one more Lucas device. So the ventilators actually came today. The Lucas device came a couple weeks ago. So once I get those on our trucks, again, a phenomenal resource we have in Fitchburg. All 5 of our trucks will be equipped exactly the same with all of those advanced care items. So again, a huge shout out to Epic for being able to provide that to us. So I'll put that in here, and then we'll see that money essentially go in. That's why we see the savings account so high. That money will come in and then just go back out within the next, probably by the time we meet again in a month. Reminder with our assigned balances, that's that sick time account. Those are now CDs, so we're not going to see any interest short of that top number there, which was just kind of the leftover stuff when we invested in the CDs to begin with. So we're going to see a couple cents in there in interest every month. Beyond that, the 1 year and 2 year CDs, we're not going to see the interest on that for 1 year or 2 years. So those numbers aren't going to change. But but reporting the numbers as part of our financial kind of stability. No donations in October, a couple of milestones. So that was earlier this week. It says 6 years. Jeff just completed his 6th year. He actually just started his 7th year with us as of Monday. And then Jen Ross, who's one of our LTs, who's been with us for 12 years. Those are our milestones. That's what I've got for my chief's report. Let me bring up the quick. You saw this as far as the email. I emailed this out to you with the in-house operating budget as far as our finances to date. The numbers I guess I always like to look at is we are 83.3% of the year through the year. And if you look at the down at the bottom, we spent 82.8% of our budget. So we are spot on as far as where our spending is. A little bit over as usual, as I have shared in the past, with our medical supplies, which continue to be insane. We're actually starting to see some shortages in our drugs now. So that's not going to help contribute to some of the problem here, some of those drugs that we use quite a bit, as well as our tune-ups and repairs. So just getting our trucks fixed. We're over with that line item as well. But fortunately, it's been meshing pretty good with some of the other things we're under with as far we're at. So any questions on either one of those two documents?
Chief, I heard there is a nationwide Narcan shortage. Are you guys experiencing any of that? Or?
So off the chance I heard is Narcan. What it is it's Aspira, who's the pharmaceutical producer. From our source at Meritor's, where we get our drugs through, she did not specifically mention Narcan to us. We're seeing unfortunately, it's epinephrine is what we're seeing the shortage of, which is just one of those bizarre things that takes 5 cents to make. But we're actually in our pre-filled syringes where they're seeing a shortage of epinephrine to the point where essentially we're a part of a larger buying group, and the supplier has actually said you have had your allocation for the month. So wow. The pluses and minuses of a larger buying group. Now we're sharing those same limited resources. The plan is to switch over to. We saw the same thing probably 10 years ago. When we switched over to actually a higher dose epinephrine bottle. So we essentially just carried 2 pre-fills that we just, those initial uses, and then we just started making our own from the more concentrated stuff. Unfortunately, what I got for her is the same people that make the pre-filled epi that's a shortage are the same people that make that multi-dose vial of epi that's going to be shorted.
Okay.
Yeah, so keeping an eye on that. We will do the best we can do, but I had not heard about Narcan. Bags of saline was the other one that's kind of on that list, which, like, of all things, only gets water in a plastic bag, but what do I know?
Yeah. All right, thanks.
You're welcome. Any other questions?
Okay, thank you.
Yeah.
Any other questions for Patrick? If not, let's move on to the chair's report. I believe the Finance Committee did meet last month or this month.
We did. And David, I don't know if you actually knew you're the chair of that committee.
I am?
You are, yeah.
I did not know that.
I don't know if you knew. Mike was the previous chair. So since you took his chair, you were actually the chair of that. I don't know if you want to give them a summary of what happened. Otherwise, I am more than happy.
Why don't you go ahead? I'm a little flummoxed. I did not know I was the chair. Sorry.
Sure. I actually just thought about that this morning. I'm like, I wonder if you actually knew you were the chair of that.
Oh, shoot. Okay.
Yeah, no worries. So in a nutshell, I can email out. I actually think I emailed the presentation out to everybody the day of that meeting. Let me just pop it up here. So we met, and what I did was actually between, I think we had that was just the group that was there was our finance committee. Looked at for essentially 5 different options, right? One of those was not to increase our base rates at all. The first one was to essentially increase based on the regional increases is what I've called them. And that's looking at what the other ALS services around us charge. And it kind of increased proportionally or comparative based on them. The second one was increase based on our budget. So the example was if we have a 3% increase in our budget, we just increase our rates by 3%. Another option was to look on based on cost of living. So pulling that historical data and increasing base rates that way. The fourth one was a 50-50 approach, in that historically the municipalities pay about 50% of our budget. Run revenue pays for the other 50% of that budget. That waxes and wanes about 3 to 5% based on the budget year, and it's always changing. But essentially, we could take the approach to realign those every year and raise rates. I don't know that we'd ever lower rates, but raise rates based on that. So after some pretty good discussion, I can show you that you should have all had this. This is what it looks like for us in our surrounding. I just picked the 5 paramedic services here in Dane County. There are more than that. And I can easily pull that for next year when we look at this. But this is what it looks like for around us. Essentially based on the discussion. So kind of given one of the current financial state with a little bit of tapping into our reserves and the need to build that back up, as well as the potential for the town of Madison, or when the town of Madison comes in next year, we're going to see probably some increased operating costs with that. Was actually to kind of take this regional approach is what the group discussed and decided on. So what it would do our current rates are $1,100 and $1,200. Based on that slide you saw previously, we would raise a resident to $1,300 and a non-resident to $1,400. It is an 18% increase, which sounds pretty big. We are still not the highest in Dane County. We're just actually matching what our partners throughout Dane County are doing. What it would do, kind of putting things in the numbers wise, is it would increase run revenue by about $180,000 next year. What that would do would be, and that's just money in next year. This wouldn't take effect until January 1st of next year. So we would get that income over the course of next year, but it doesn't change the 2022 operating budget because that has already been approved in past. Fortunately, we're always kind of playing catch up. What we potentially could do would be to have this discussion in April of every year and then make those changes on a forecasted budget versus making these changes for next year and then having them impact in 2 years from now. What that would do to change those rates next year, operationally wise, would take from estimated run revenue from 47% of our budget and take it back to the 52% of our budget. So we're swinging a little bit more towards the side of user fees operating our budget than the taxpayer municipality subsidizing or supporting of our budget. I did bring in, it wasn't here, I think it was actually in the tail end here, something to note, in our 2022 budget, even as it stands with user fees being 47% of our budget and the taxpayers paying 53% of our budget, if we take the population of our service district from what the taxpayers pay of that 53%, every resident is still only paying $37.34 for their EMS service. So when we actually look at that countywide, we are spot on in the middle. There's some, and it's mostly the smaller municipalities that are up to the $80 and $90 per person, just because they are so small and they don't have the volume we have. And there's some that are less just because they have a higher amount of volume. Most of them, they tend to still be volunteer services, so their overhead is much, much lower. So kind of putting into perspective, every resident in the current system is only paying just about $40 a year for their EMS services. So the recommendation, again, from that committee was to do that first proposal there, which was a regional increase and increase them those numbers. Any other questions or discussion, or anybody from the committee that I missed anything you felt should be brought to the table?
No, that's what we discussed.
Yeah,
Okay.
that sounds fine.
Okay. Well,
What
thank
everybody
you.
thinks about it. That's the question.
So
Well, let's move on to the next agenda item then, which is review and possible action
Yep.
on what the Finance Committee set forth.
yeah, so we'll need a motion to raise those rates as recommended by the Finance Committee.
Any
I would make a
discussion?
motion to raise those.
Okay,
as
second.
recommended.
Lonsdorf, second.
Okay, any further discussion? If not, I'll call
Good
for the
job.
vote. Oh, go ahead.
Nope, just said good job. Finance
Oh,
group.
okay. Okay, thanks, Sue. Okay, all in favor, signify by saying aye.
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 Aye. Anybody opposed? Hearing none, the rates as set forth by the Finance Committee are approved.
Those will take effect January 1st of next year. I'll share that with our billing company, and then we'll see those numbers. Those numbers will be used to determine estimated run income in the 2023 budget, and we'll lean it a little bit more towards, again, the user fees.
Yeah, it'll be interesting to track and see what the actual impact is.
Yeah, I mean, if you look historically, we continue to raise rates in those little increments. We also tend to see our collection rate drop. I mean, it's been little bit percentages, but it's continued to drop, right? The more we raise rate, we can charge whatever we want. We're only going to get X amount of dollars from some of those government entities based on those higher rates. So we'll continue to report back to that every year.
Okay, thank you. Well, let's move on to the next one, which is review and possible action on resolution 2021-06, funds from the ambulance sale. And this is follow up from the discussion that we had at our September 16th meeting.
Yeah.
And
not a huge resolution writer, so that's what it turned into. You got that emailed to you? I think I hit all the high points. And just traditionally, the funds we use in the sale go to purchase the next ambulance. We still have some significant funds left, that $9,000 left from the sale of the last ambulance that we can apply towards the 2023 purchase. So since we actually got an anomaly of $22,000 minus that $99 there, almost to take that, and we decided, you decided 2 months ago to put that into the reserve fund and help build that back up. Which, as much as I'd like to tell you, we're going to put that in the reserve fund and build that back up, we just replaced a fuel system for $11,000. So thank you for helping to pay to replace a fuel system.
yeah, nothing's cheap these days.
That was an oops.
Any more discussion? Otherwise, a motion to approve would be in order.
I move we approve the resolution 2021-06 as
A
written.
second?
Second.
All in favor, signify by saying aye.
Aye.
Aye. Anyone opposed? Hearing none, the resolution 2021-06 is approved as submitted.
Kind of build onto that one just for your information. Current, I think I brought this up in the past, current ambulance builds, we are talking about 16 to 18 months out. So though I officially can't spend money in 2023 yet, because that has to go through the CIP process, unofficially, I'm actually working with our ambulance buyer to get our names on a 2023 truck, probably by the end of the year, or we are not going to see it in 2 years from now.
Wow.
Wow. Say,
Are
quick
they
question.
beginning-
When will all the ambulances be going to electric? Any word
There
on
is-
that?
There is one out there. There was actually one just featured. I don't know. I'd love to tell you what I'm hearing about the electric fire truck from the city of Madison and how successful that's gone, but we're being videoed, so I'll keep those comments to myself.
Okay. Let's see, next agenda item is,
I think David had a question.
Yeah, David had a question.
That was the same question I had, was when are we going to see an electric ambulance?
There is one out there. I actually just saw it featured. I'm very curious. My plan is to continue on for the hybrid one for a while. Let somebody else work those bugs out. Like I said,
Yeah, maybe we should get the second or third model.
probably.
yeah.
There is the picture of that electric fire engine being towed back up to Appleton here in the not recent past.
No, not too good. Ultimately, though, it makes sense for EMS.
Yeah.
Let's move on then. Item number 10, review and approval accounts payable checks. Anybody have any questions for Chief Anderson? If not, a motion to approve is submitted.
Motion to approve.
The second,
Second, Lonsdorf.
thank you. All in favor of approving the accounts payable checks as submitted, signify by saying aye.
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 Anyone opposed? Hearing none, the accounts payable checks as submitted are approved. Next item is review and possible action on Gatsby 54 revisions.
Well, it is updating the numbers that you see every month, those prepaids that are determined by the accountant that we are liabilities for the future. And then we haven't spent anything for our FAP funds. The sick leave is in that CD. Haven't touched our contract negotiations. Contract negotiations will be next year and the ambulance purchase. So the only thing that I think changed is that last weird number about the sick leave. This will be the last change now for a while, now that it's in the CD.
Oh, the 218,000 or?
Yeah.
Okay, there were a couple typos in there, but I'll send them to you later.
Yeah, please do. I just copy it from, I'm sure there's probably about 2 years worth because I don't change anything but that section.
I actually read it word for word and I just picked up a couple little things.
Oh,
nothing
yeah,
big.
got the capitalizing of my district too. I got to fix that.
Okay, a motion to approve.
Make a
I make a
motion to
motion.
approve.
I second.
All in favor of approving the resolution 2021-07 is submitted, signify by saying aye.
Aye.
Anyone opposed? Resolution 2021-07 is approved as submitted. Yeah, any other business? I guess this is where we miss Mike. He used to always talk about
His extrication project in the spring.
yeah. Wonder if he's still doing that. Oh, well. Patrick, I can print these out and sign them and just drop them off sometime.
That'd be perfect. We probably have about 3 months of them in there that need to be signed. Probably just leave the whole binder for you in the entryway sometime.
Okay, yeah, why don't you do that and I'll stop by.
Okay.
Just send me an email when you got it out there and I'll just stop by when I take the dog for her walk.
Okay. Yeah, that sounds perfect.
Okay. If that's it,
So Scott was pointing out to me that I have the date wrong next month. It should be December 16th,
Yeah, thanks. I was just noticing that.
which is the Thursday. And I told him it was wishful thinking. I really don't have anything unless something comes up to have a meeting next month. We probably didn't even really need this month, other than we needed to do the rate changes. So there's nothing on my radar that would require us to meet in December. Up to you all, but I would propose that maybe we skip December's meeting and meet in January.
sounds good unless something comes up that you need to call like an emergency meeting.
Yep.
That'd be great. Yeah.
Okay.
So next meeting would be January, whatever.
20th, 20.
Okay, 2022. Okay. Hopefully by then I'll have my Zoom working again. So I guess I'd entertain a motion to adjourn.
Second.
So moved.
Okay, all in favor?
Aye.
Aye.
Yeah, guys, have a good night.
Happy
Happy holidays.
Thanksgiving, everybody.
Yeah, it is.
Yeah.
Bye-bye, everybody. Thank you very much.
Bye.